Okay, so what's so different about the practice that I'm part of, right? Present Center for Mindfulness and Healing. So, my brand is Delaware Present Therapy. I developed the program Heal Yourself, and I work at the Present Center for Mindfulness and Healing. So, the Present Center is a mindfulness based practice. So, there's several other clinicians that work there. But what's different about us is we have a cater to your needs type situation. So myself, I offer concierge texting and coaching services through a HIPAA compliant app to all my patients. So if something's up, they can reach me pretty much 24 hours a day, 7 days a week, unless I'm sleeping. But as soon as I see a message come through for them, I respond. So if there is some type of situation, they can feel supported in that process. What do we do with the practice that makes it different? Well, I have emotional support animals for those who have texture and tactile responses and like to feel that warmth across their body, right? So we have an emotional support kitten, and we have an emotional support dog. He's a little Frenchie, super cute. And then what we do further is we make sure that our patients always feel like they're at home. You want to walk in and feel like you're walking into a family member's house. So all of our different patients have their favorite snacks stocked up on there. We ask them what their favorite snacks are, favorite drinks are. We stock up on that to make sure that we remain culturally sensitive and open to what people's processes are. Sometimes people like tactile, sometimes people like food. So we're catering to their needs in a way that's not going to enhance any mental health. If they have an eating disorder, we're using that food to teach mindful eating. If they have different stimming responses, we're going to do things that can help them feel into those responses and feel better. What we want to do is we want to make everyone know that they are loved and that they are supported and that we are going to be there for them. What do we do virtually? So virtually, I work with a lot of kids virtually. I work with a lot of adults virtually. If there's anxiety issues and stuff like that, we tend to work on projects, right? So I will mail my patients different paint sets or slime, and we will create things in session while talking the same way I do with the practice. The patient comes in, they're uncomfortable, and we notice we want to enhance that, we want to get into it, and we want to give them a healthy outlet. So we bring out the slime, we bring out the paint sets, we bring out the stuff so that even as an adult you can still learn to be a kid and come into eye contact on your terms when you're ready. Some people feel super uncomfortable the first couple of sessions. They don't want to make eye contact. It feels uncomfortable for them, and I personally don't feel like someone has to be forced to do that. When they're ready, they're going to open up and be there when they trust you. And, being a therapist, it's about building that trust. So we have thepresentcenter.net, which lists all the clinicians, everything that we do at the practice. We are going to be hiring a nurse practitioner soon. We're super excited about that. And then mine, Delaware Present Therapy, that talks a lot about the integrative healing program. It talks about the emotional support animals. You can find us all on Psychology Today as well. So if you have any other questions about the practice or how we operate, feel free to send messages and ask those questions.